Hi everyone, my name is Amy Brown and I'm a Professor of Child Public Health at the College of Human and Health Sciences at Swansea University. My research looks at how we can better support mothers to feed their babies. So understandably at this time during the coronavirus outbreak we've had a number of queries from worried families. I wanted to just come on and try and reassure you with some of the evidence that we have about feeding during this time. So the first one is, can I still breastfeed my baby? And absolutely the answer is yes. So the World Health Organization, the Department of Health, they all encourage you that if you're pregnant and you're due to feed your baby, to try and breastfeed them. And if you're breastfeeding them now, it's absolutely safe to carry on. We have absolutely no evidence that the virus can be transmitted in breast milk, but we do know that when mothers are feeding their babies during other infections, that they start to produce antibodies that can protect their baby, that get passed to them in their breast milk. We don't have the evidence yet because it's too early for this outbreak, but we know that from the SARS outbreak some years ago that mothers who were breastfeeding at the time and who contracted SARS did go on to produce antibodies for their baby. So yes, absolutely, carry on. The second one is, can I still carry on breastfeeding if I'm unwell? So if you have the coronavirus, can you carry on breastfeeding your baby? And again, the answer is yes. So you have to think that if you have been exposed to and contracted the virus, then it's probably likely that your baby has been exposed to it as well. So if you think about the previous point that if you have the virus, you will probably be producing antibodies for your baby. So the very best thing you can do is to carry on breastfeeding them. If you become too unwell to care for them, or if you are separated from them for whatever reason, then the suggestion would be that you could try and express milk to give to your baby. So if you're able to try and get milk to your baby if possible. The third one is for parents who are breast or bottle feeding. So how can I reduce the chances of passing the infection onto my baby? So as is the advice for the general population, wash your hands as much as possible. So wash your hands before picking up your baby. If you've changed their nappy, wash your hands before you're preparing any bottles for them. Just wash your hands as much as possible. And it's really important during this time, as it is always, but really important now, to do things like make sure you're following instructions to prepare the formula correctly, to make sure that you're sterilising any breast pumps that you might have touched. If you're making up a bottle, that you've sterilised all the parts there. The advice is that if you're feeding your baby and you have the virus, to wear a mask just to try to pass on and reduce the risk of passing on the infection to your baby. The fourth question we've had is around getting hold of formula milks. So a number of parents are very anxious at the moment because people have been panic buying, unfortunately, in the shops, and they haven't been able to get hold of their chosen formula. Now, there are a few things to bear in mind here. First of all, it's not a supply issue with the formula. There is plenty of formula out there. It's been an issue with people panic buying. So lots of shops are now putting things in place where you're only allowed to buy perhaps, say, 2 cans, so people can't hoard the product. If your milk isn't on the shelf, remember that unless you have a special prescription milk prescribed by a medical professional, then you can give your baby any other stage 1 formula milk. There is very little difference between them. So if you're on one product, you can just simply move your baby to a different product and try a different one. If you're still really struggling to find it, perhaps you could contact your midwife or health visitor for advice. But also if you go to a pharmacist, most pharmacists will order the product in for you. It might take a few days and it might be a little bit more expensive, but there is the support there. We really are going to get formula milk to you if you need it. So what we'll do as well is we'll pop lots of links in this video, put them up so you can follow them. Unicef Baby Friendly in particular have an amazing fact sheet on feeding your baby. The Breastfeeding Network has information. If you're worried about getting support at this time, because particularly with breastfeeding, a lot of the face-to-face groups may be shutting down, there is still support out there. So talk to your midwife again or health visitor about what local support might be available. If you go along to a breastfeeding support group, usually have a look on Facebook because there are a lot of local Facebook breastfeeding support groups that you might be able to access some information from there. We'll also put a few more links in this video about some of the big breastfeeding groups that you can find online. Breastfeeding Yummy Mummies is a great one, very evidence-based, very moderated, so you know that you get good information. If you have breastfeeding queries and you can't get hold of your midwife or health visitor or want to chat to someone else, you can still contact the National Breastfeeding Helpline. They are there for any queries. Also the NCT, Lactation League, all the main breastfeeding organisations have their support line and people waiting there for you. If you have perhaps more a complex problem or you really want to chat things through with people, there are a number of lactation consultants now who are doing online conversations and support sessions. So have a look for them. If you look on the Lactation Consultants Great Britain website, you should have a list on there of all the qualified lactation consultants who really are very specialised in helping with any tricky problems you might be having. So most of all, have a look at the links, keep washing your hands and just generally look after yourself. Okay, thank you.